Etanercept is a powerful medication that has gained widespread attention for its potential in treating various medical conditions. In this video, we will delve deep into unlocking the potential of Etanercept, understanding its uses, benefits, and potential side effects. If you're wondering what Etanercept is, it is a tumor necrosis factor (TNF) inhibitor that works by blocking the activity of TNF, a substance in the body involved in inflammation. This makes Etanercept a valuable treatment option for conditions such as rheumatoid arthritis, psoriasis, and ankylosing spondylitis. While Etanercept has proven to be effective in providing relief from symptoms, it is important to be aware of its potential side effects. These can include injection site reactions, infections, and in rare cases, allergic reactions. Understanding these risks is crucial in making informed decisions about whether Etanercept is the right treatment option for you. This comprehensive guide will provide you with the information you need to know about Etanercept, including its uses, benefits, and potential side effects. By the end, you'll have a better understanding of the potential of this medication and how it can help improve your quality of life. Understanding the mechanism of action. To fully appreciate the potential of Etanercept, it's important to understand how it works. Etanercept is a TNF inhibitor, which means it blocks the activity of tumor necrosis factor, a substance that plays a key role in inflammation. By inhibiting TNF, Etanercept helps to reduce inflammation in the body, providing relief from symptoms associated with conditions like rheumatoid arthritis, psoriasis, and ankylosing spondylitis. When TNF is released in the body, it can trigger a cascade of inflammatory responses that contribute to pain, swelling, and joint damage. Etanercept acts as a decoy receptor, binding to TNF and preventing it from interacting with its target cells. This effectively reduces the inflammatory response, alleviating symptoms and improving quality of life for individuals with these conditions. It's important to note that Etanercept is not a cure for these conditions, but rather a treatment option that helps manage symptoms and slow down disease progression. The potential of Etanercept lies in its ability to provide significant relief and improve overall well-being for individuals living with these chronic conditions. Common uses of Etanercept. Etanercept has been approved by regulatory authorities for various indications, making it a versatile medication for the management of certain medical conditions. The most common uses of Etanercept include rheumatoid arthritis. Etanercept is widely prescribed for individuals with rheumatoid arthritis, a chronic autoimmune disease that primarily affects the joints. By reducing inflammation, Etanercept helps alleviate pain, swelling, and stiffness, improving joint function and quality of life. Psoriasis. Psoriasis is a chronic skin condition characterized by red, itchy, and scaly patches on the skin. Etanercept has been approved for the treatment of moderate to severe plaque psoriasis, providing relief from symptoms and improving the appearance of the skin. Ankylosing spondylitis. Ankylosing spondylitis is a type of arthritis that primarily affects the spine, causing inflammation and stiffness. Etanercept is an effective treatment option for ankylosing spondylitis, helping to reduce pain, improve mobility, and slow down disease progression. Juvenile idiopathic arthritis. Etanercept is also approved for the treatment of juvenile idiopathic arthritis, a chronic condition that affects children and adolescents. By reducing inflammation, Etanercept helps improve joint function and prevent long-term complications. These are just a few examples of the common uses of Etanercept. It is important to consult with a healthcare professional to determine the most appropriate treatment option for your specific condition. Benefits of using Etanercept. The use of Etanercept can bring about a range of benefits for individuals suffering from certain medical conditions. Here are some of the key advantages of using Etanercept. Symptom relief. Etanercept has been shown to provide significant relief from symptoms such as joint pain, swelling, and stiffness. This can greatly improve the quality of life for individuals living with conditions like rheumatoid arthritis, psoriasis, and ankylosing spondylitis. Improved joint function. By reducing inflammation and slowing down disease progression, Etanercept can help improve joint function and mobility. This allows individuals to engage in daily activities with greater ease and comfort. Reduced disease activity. Etanercept has the potential to reduce disease activity in conditions like rheumatoid arthritis and psoriasis. This can lead to fewer flare-ups, reduced joint damage, and better long-term outcomes. Enhanced quality of life. Living with chronic conditions can significantly impact one's quality of life. Etanercept can help alleviate symptoms, allowing individuals to enjoy a better quality of life with improved physical and emotional well-being. It's important to note that the benefits of using Etanercept may vary from person to person, and it is essential to discuss your specific situation with a healthcare professional. Potential side effects and risks. Like any medication, Etanercept does come with potential side effects and risks. It's important to be aware of these potential complications in order to make informed decisions about your treatment. Some of the common side effects of Etanercept include injection site reactions. It is common for individuals to experience redness, itching, or pain at the injection site. These reactions are usually mild and resolve on their own. However, it's important to inform your healthcare provider if you experience persistent or severe injection site reactions. Infections. Etanercept can increase the risk of infections, including respiratory tract infections and skin infections. It is important to promptly report any signs of infection to your healthcare provider, such as fever, cough, or skin rashes. Allergic reactions. While rare, some individuals may experience allergic reactions to Etanercept. Signs of an allergic reaction may include hives, difficulty breathing, or swelling of the face, lips, tongue, or throat. If you experience any of these symptoms, seek immediate medical attention. It's important to discuss the potential side effects and risks of Etanercept with your healthcare provider to determine if it is the right treatment option for you. They can provide guidance and monitor your progress to ensure your safety and well-being. Precautions and contraindications. Before starting Etanercept treatment, it's important to inform your healthcare provider about any pre-existing medical conditions or medications you are currently taking. Certain precautions and contraindications may apply to the use of Etanercept. These can include history of infections. If you have a history of recurrent or chronic infections, it is important to discuss this with your healthcare provider. Etanercept can increase the risk of infections, and alternative treatment options may be considered. Tuberculosis. Etanercept can reactivate latent tuberculosis infections. It is essential to be screened for tuberculosis before starting treatment with Etanercept. Immunizations. It is generally recommended to complete all necessary immunizations before starting Etanercept treatment. Live vaccines should be avoided during Etanercept therapy. Always follow the guidance of your healthcare provider and inform them of any changes in your medical history or medications during your treatment with Etanercept. Dosage and administration guidelines. The dosage and administration of Etanercept will vary depending on the specific condition being treated. It is important to follow the instructions provided by your healthcare provider and the medication's prescribing information. Here are some general guidelines. Rheumatoid arthritis. The usual recommended dose for rheumatoid arthritis is 50 mg administered once a week through subcutaneous injection. Psoriasis. The initial recommended dose for psoriasis is 50 mg administered twice a week for the first 3 months, followed by a maintenance dose of 50 mg once a week. Ankylosing spondylitis. The usual recommended dose for ankylosing spondylitis is 50 mg administered once a week through subcutaneous injection. Juvenile idiopathic arthritis. The dosage of Etanercept for juvenile idiopathic arthritis will depend on the weight of the child or adolescent. It is important to follow the specific dosing instructions provided by the healthcare provider. Always consult with your healthcare provider to determine the appropriate dosage and administration guidelines for your specific condition. Alternatives to Etanercept. While Etanercept has proven to be an effective treatment option for many individuals, it may not be suitable for everyone. There are alternative treatment options available for the conditions Etanercept is commonly used to treat. These alternatives can include other TNF inhibitors, such as adalimumab and infliximab, as well as non-TNF inhibitor medications like methotrexate and corticosteroids. The choice of treatment will depend on various factors, including the specific condition being treated, individual patient characteristics, and the preferences of the healthcare provider and patient. It's important to discuss these alternatives with your healthcare provider to determine the most suitable treatment option for you. Research and studies on Etanercept. The potential of Etanercept has been extensively researched and studied. Numerous clinical trials and real-world studies have been conducted to evaluate its safety and efficacy in different populations. These studies have provided valuable insights into the benefits and risks of Etanercept, helping healthcare providers make informed treatment decisions. Research has shown that Etanercept is generally well tolerated and can provide significant relief from symptoms in conditions like rheumatoid arthritis, psoriasis, and ankylosing spondylitis. However, it is important to note that individual responses to treatment may vary, and close monitoring and regular follow-up with a healthcare provider are essential. Conclusion and final thoughts. Etanercept is a powerful medication that has the potential to unlock a better quality of life for individuals living with certain medical conditions. Its ability to reduce inflammation and alleviate symptoms makes it a valuable treatment option for conditions like rheumatoid arthritis, psoriasis, and ankylosing spondylitis. While Etanercept can bring about significant benefits, it is important to be aware of its potential side effects and risks. Understanding these risks and discussing them with your healthcare provider will help you make informed decisions about your treatment. If you believe Etanercept may be a suitable treatment option for you, consult with your healthcare provider to discuss your specific condition and determine the best course of action. Together, you can unlock the potential of Etanercept and strive towards a better quality of life. Thanks for watching.